Hey everyone, so today we're going to talk about gastrointestinal drugs, specifically our antacids and our anti-ulcer agents. So let's define what we're treating when we have to use an antacid or an anti-ulcer agent. And what we're treating is GERD. What is GERD, you ask? It just stands for gastroesophageal reflux disease. So you see the G-E-R-D, it spells GERD, and that's more commonly known as heartburn or chronic acid reflux. So that occurs when stomach acid frequently flows back into the tube that connects the mouth to the stomach. So that's what's known as your esophagus. This is backwash essentially, and that backwash acid reflux irritates the lining of the esophagus because it's acidic. It's coming from the stomach, and this stomach acid is going places where it shouldn't be going. So this acidic backwash gets into the lining of the esophagus and it really irritates it. Now, this is usually managed through lifestyle or dietary changes, so avoiding spicy foods, maybe stopping eating certain foods or meals that you know might cause heartburn for you. Or you can also take over-the-counter drugs, and that might include some over-the-counter antacids. But management sometimes requires prescription drugs, so we'll talk about both. And as you can see, this is a better illustration for the cause of acid reflux. So as you can see, in a healthy stomach, we've got all of our stomach juices in there, and they're just circulating, they're digesting the food, and we're not having any problems because the diaphragm right here is pinching off the space, this lower esophageal sphincter, which is just like a door between the esophagus that connects to your mouth and the stomach. So when the diaphragm is working and the sphincter is closed and it's actively closing it, that's what a healthy stomach is. So this person's not going to have reflux. However, in a person with gastroesophageal reflux disease or GERD, the lower esophageal sphincter right here is open and it's not closing properly. And that's what causes acid reflux, because the stomach acid is then able to travel up into the esophagus and irritate that tissue right there. So what can we do to help treat this? Well, firstly, we would want to use antacids. And you guys are familiar with antacids. That's your Tums, that's your similar like calcium pills, that kind of thing. They work in multiple ways to reduce acid production in the stomach or neutralize stomach acid. So if you remember way back to your science classes, potentially, how do you neutralize an acid? You put something that's basic in it and it gets to a more neutral pH. So these are basic drugs which you're able to put into your system to neutralize that acidic environment. By doing so, you get rid of the stinging and acidic effect of that stomach acid, and you help improve those symptoms of heartburn, those burning sensations in the chest. Now, they may have significant drug interactions. This is the big thing with antacids, especially with antibiotics. So your tetracycline antibiotics and your quinolones interact quite strongly with the antacids. Now, if a drug is oral and it requires stomach acid to dissolve it, it might interact with the antacid, because if the stomach needs to have a certain level of acidity and you take an antacid, it's not going to be able to break down that drug in the most effective way, and you won't get the full effect of the drug, the full therapeutic effect. So it might interact with an antacid, especially if it's taken within 30 minutes to 2 hours after. So usually patients are instructed to wait to take their antacid until a few hours after taking a drug that could potentially interact with it. Now, most antacids are used at the onset of reflux, so you have to have heartburn first in order for the antacid to work, although some might be used for prolonged periods of time. Next, we have our anti-ulcer drugs. So a peptic ulcer, peptic is just another word for stomach related. So a peptic ulcer, they're wounds caused by hypergastric activity. So lots of stomach activity, hyperacidity in the stomach, or an infection potentially in the stomach as well. And that damages the tissues in the stomach and the gastrointestinal tract. So if left untreated, ulcers can induce pain. It can have bleeding. If you were bleeding internally, you could potentially have anemia as well, which is a low red blood cell count. And you can also have permanent damage to gastrointestinal tissue. So that's why it's super important to treat these peptic ulcers. Now, many prescription antacids are also used to treat and prevent ulcers, which makes sense considering they lower the acidity of the stomach. So it's not going to interact with that stomach wall and burn through it as much. Now, two very common causes for peptic ulcers, by the way. NSAIDs, your non-steroidal anti-inflammatory drugs, so your Aleve, your naproxen, those ibuprofen, those types of drugs. they're particularly hard on the stomach and they can cause ulceration within the stomach there. And then there's this thing called H. pylori. This is just a specific type of bacteria which lives in the gut, and that predisposes people to having ulcers. Now, special dietary measures might also be taken to prevent the formation of peptic ulcers. So low acid meals, think beans, think avoiding salsa, spicy foods. Those can help, but occasionally we do need some drug therapy. Drug therapy like what, you ask? Well, this is the go-to. Our proton pump inhibitors, or PPIs for short. They are used to treat both GERD, so heartburn, as well as peptic ulcers. Now, PPIs work by decreasing the amount of acid that's made in the stomach. So they actually work in the stomach. Those acid-secreting cells, those proton pumps that work to create this acidic environment in the stomach, it limits the amount of acid they can make. And by doing so, it helps lower the acidity in the stomach and treat that frequent heartburn and those symptoms that you would associate with it. And they're very easy to remember because all those generic names end in the suffix prezol. So they all end in prezol. Side effects in counseling for PPIs, you have to space them out, again, from other oral medications because they reduce a lot of oral medications' effectiveness, especially antibiotics. Now, a side effect of PPIs that's common is actually nausea, vomiting, and diarrhea, as well as abdominal pain or bloating, which makes sense, right? You would have gastrointestinal side effects if you are working on a drug that's reducing the acidity, because you might not be digesting things as well if your stomach doesn't have as much stomach acid in it. It's a trade-off. Omeprazole or Prilosec, you might recall Prilosec OTC, super, super common. It's available prescription as a delayed release capsule. So that can be good for treating or preemptively treating or prophylaxing stomach acid and heartburn symptoms. So a lot of people will take these capsules you see right there, omeprazole 40 milligrams once a day, and that can really help manage their heartburn symptoms. It's also available as a tablet over the counter. Then we also have esomeprazole or Nexium, again, another very, very common one. Lansoprazole or Prevacid, dexlansoprazole or Dexilent, and pantoprazole or Protonix. We also have what's called histamine receptor blockers or H2 receptor blockers, and they're useful in that they're used to, again, both treat GERD and peptic ulcers. So what they do is they inhibit the secretion of gastric acid, that's acid within the stomach, by blocking the effects of histamine in the stomach. So they're sometimes paired with antacids as well. So like Pepto-Bismol, Maalox, that's like the magnesium, like milk of magnesia type thing. They help relieve heartburn more quickly if you take them like that. Now we have generic H2 blockers, and those all end in tidine. So T-I-D-I-N-E, tidine, that's how you can tell what they are. Side effects in counseling, very similar to PPIs. You have nausea, vomiting, and diarrhea, bloating, dry mouth, and difficulty sleeping. That's with those histamine effects. They do have quite a few drug-drug interactions as well. So always keep that in mind. Now, examples, the one that's really on the market right now is Pepcid, and that's famotidine. Notice again, it ends in tidine. That's available as a tablet, liquid, or IV injection if you're in the hospital. So if you're working in the hospital, you may see famotidine injections be dispensed within the pharmacy. Now, we used to have ranitidine, and you'll notice I crossed that out, or Zantac, and that was recalled in 2020 actually due to a cancer risk. So although it might show up in your top 200 drugs, it's no longer in use. So that pretty much takes care of our drugs for GERD and our PPIs and all that good stuff. If you have any questions, feel free to contact me. Thank you.